Okay.
On the very first day of class, we learned that we'd be giving a demonstrative speech. And from that very moment, I knew exactly what I was going to be doing right over. It's something that I do quite often, and I actually enjoy doing it. But it's probably something that the common population doesn't do very often, and they probably wouldn't like it. In fact, blood squeamish people probably couldn't do it at all. Today, I'm going to teach you the basics of starting an IV by demonstrating and explaining the beginning, middle, and end steps of IV starting. So we have my little lovely assistant up here, and I named her Armetta, and she's going to be helping us today because she's a very cooperating individual. I've broken down the main steps of starting an IV into 3 categories. The first part is the setup, and then the second part is the actual stick, and the third and the last part is cleanup. Okay, so to start out, we have to introduce ourselves to the patient. Well, actually, sorry. First, we have to get all of our supplies. We'll need our IV catheter, which is actually what we stick with. Here's a different one, but we're going to use this one because it's easier to see. We'll need our C-band, or the constricting band. Alcohol wipes to clean the area with. Keep digging in my pockets here. A lot of times, you'll have an IV kit. I don't hardly ever use them. The only thing I'll use out of them is the sterile bandage, but we'll need that. And we can either attach IV tubing, which is what you'll get your medicine through if you have one, or you can flush the end of the catheter once it's in with saline, which is what we're going to do because it makes more sense today. Then we got to have our gloves, which will be in the patient's room. But we don't have a patient's room, so they're in my pocket. And you'll need a sharps container. Okay, so next thing you're going to do is introduce yourself to your patient and explain what you're doing, like so. Well, hello, Miss Armetta. Today I'm going to be your nurse and I'm going to be starting an IV. There you go. Next thing you're going to do after they okay it, you're going to window shop. By window shopping, you actually look at the arm or wherever you're going to put it. In Armetta's case, it's an arm. We're going to look for a nice, pretty blue vein. Some people don't have those nice, pretty, visible blue veins, so we have to feel. And what we're feeling for is like a kind of rubber band-like, kind of hard, kind of squishy, but we'll call it rubber band-like. Okay, so on her, there's one right here, and there's one right here. We'll go for the hard one. We'll go for this one right here. Okay, we have our spot picked out. So next, we have to clean the area with an alcohol wipe for 30 seconds in a circular motion, starting from the inside and working your way out. But since we're pressed for time, I'm not going to do the full 30 seconds, but you get the point, 30 seconds. Okay, those simple steps right there complete the beginning steps. Now we move on to the actual stick process. So the first thing we have to do is we have to put our gloves on. I put them on, I don't really care, I don't want to get blood on me, so it's mainly for me, but for the patient too. I don't want to get blood on me, that's just nasty. Okay, we get our gloves on, and then we apply our C-band or constricting band. It has to be at least 6 inches above the point where you're going to stick, no more than 6 inches. We do it like this. We want to make sure it's really tight so the vein will pop out even more. And you want to tie it so that when you get done sticking the IV in, you can just pull it and pop it. So, there we go. Just to demonstrate. And it's kind of hard to do with gloves on because they get stuck. Next, you take your IV catheter that you chose, open it up. Okay, here it is. Very simple. There's a needle there, and you'll look at it, and there's a little bevel, which if we have time later, I'll show you after class if you really want to see it, but there's a little bevel at the end, and we have to make sure that that's pointing up. Oh, by the way, you're not supposed to leave these C-bands on more than a minute, but since I'm just demonstrating, she'll be okay. She'll be all right. Okay, so we don't want the vein to roll. So to prevent that from happening, we have to apply pressure with our forefinger and our thumb and kind of stretch the vein out, so to speak, I guess. Okay, now we're going to actually stick. We have to warn the patient that we're about to stick because we don't want her to jump and, you know, knock the needle out of your hand or knock it into yourself. Okay, we are going to insert the needle at about a 15-degree angle. Once again, bevel up. It's hard to do when your hands are shaking because you're nervous too. But anyways, this is really kind of, it don't bother me, I like it. But anyways, once you break the skin and get in the vein, you'll feel a pop. Okay, yeah, I see that. Okay, well that doesn't bother me, but anyways. You'll start pushing the IV in, and then you'll see a little flash of blood, not with her because she's not attached to the Kool-Aid, but you'll see a little flash of blood here in this blue spot. And once you see that, you stop pushing the needle. You pull it out and keep threading the catheter in. Now, how many of y'all knew that the actual needle doesn't stay in your arm? Okay, I didn't know that until I started nursing, but you know, it's okay. We all learn. Needle goes in sharp container. We don't want to poke ourselves. Once this is in, we'll put pressure over it because we don't want blood to keep squirting out, which it commonly does, but not a big deal. And we'll pop the C-band. Okay, well, like I said, at this point, we can attach this. It's real simple. Just stick it in there, and then we flush our medicine through here. But we're just going to flush some saline through here. Like so. Okay. Okay. That completed the second step, the stick step. Now we're going to the third category, which is the cleanup category. The most important thing here is applying a sterile bandage over the IV site because we don't want them to get nasty boo-boos or anything because of our mistake. And I should have took my gloves off first, but okay. We get this bandage on here and we have to initial it, date it, and put the time on it because they have to be changed every 36 hours. Okay, and once we get all that done, we clean up and throw everything away that we don't need, like this, these, these. I'm just going to put in the sharp container. And there you go, we've started an IV. So now to conclude this demonstration, I want you to think of how simple that was. Okay, maybe not. I don't know. It might not have been. Maybe my instructions are horrible. But many people think that it's a very difficult process. But really, if you practice a couple times, like I've practiced on this arm, no telling how many times. So I kind of got it down before I started sticking real people. But, which was the thing I was scared of the most when I started nursing. I didn't want to stick somebody. But now it's my favorite thing to do because I'm kind of odd, I guess. But anyways, today I have taught you how to start an IV by demonstrating and explaining the beginning, middle, and end steps of IV starting.